Sure.
As people kind of grab on, as we just officially turned into 12 o'clock Central Standard Time. So my name is Corinne Jameson-Kuehl. I'm the owner of Custom Dental Solutions, and not a stranger to many of you, as most of you are our practices, you're our clients, and we've been doing webinars every week. This is the second time that we've had guests, and this is the first time, however, we've opened it up to more people than just our clients. So we're excited to meet new friends today and find new people in the dental world that we can serve. So what we do at Custom Dental Solutions is we serve private practice dental offices. And we do that by providing excellent training, business solutions, and customized care that fit our owner's philosophy. So our slogan is success your way, and that truly is our feel, that's our heartbeat, that's what we love to do in this industry. And so obviously during this time, we are very busy providing care for our offices in that way, and would love to serve you any way we possibly can. So today we wanted to offer a 1-hour webinar. It is not for CE. It is a time to discuss some practical facts and some practical information on reopening our private practice dental offices across the country. So I'm from Wisconsin, Dr. Lambert is in Michigan, and Michelle is in South Carolina. So we're in 3 different time zones, many and different time zones as well. And so just also wanted to put out there that the information that we give, unless we have something that we've backed it up with, such as like the ADA or the CDC, a lot of what you hear may be opinion, or it might be experience. And if you are looking at specific pieces for your office, you need to contact an attorney or an accountant, or feel free to shoot me an email. I can definitely provide the resources you're looking for your soft opening for a dental practice as you move into that phase of when that happens for you. So just remember, we again opened this up to everybody, and we actually have several hundred people on this webinar today. So we were only able to take questions from like the first 200. My team worked really hard at putting that information together so that we could provide the best answers possible. So hopefully we get to your question. If not, feel free to shoot us an email at the office email for Custom Dental, and we can get you in touch with the resources you need. But I'd love to introduce my guests with you today. I have Dr. Tom Lambert. He is a general dentist from Grand Rapids, Michigan. He was the first practice to close. Yes, he always likes to put his Ohio State stuff out there. He was the first practice in the state of Michigan to close during COVID. He has some background experience with that as he was out of the country and could kind of see things happening. So I really value his opinion in private practice dental offices and the know-how when to open, when to close, what to implement, and so forth. But Dr. Lambert is a member of the Communications Committee of the ADA. He does quite a bit of speaking. If you were at Course Crawl last year, you were blessed to hear him speak. He did an outstanding job. He loves to share encouragement. I call him our Chief Encouragement Officer because he's always bringing the sunshine, and he's just so encouraging and uplifting. And you'll find that today too as you get to listen to him. And of course, Michelle Strange is no stranger to podcasts and webinars. She's been working tirelessly during this COVID pandemic to educate us on infection control and OSHA standards. And so she's going to share some great information that she's had in her research process and so forth with us on some standards that we need to look at when we reopen our practices. So what this time together is not, it's not something political, it's not something conspiracist. We are looking to, we have to start somewhere, friends. We have to get in that mindset where we are going to come back. We are coming back to our dental practices, and we're going to come back stronger and more smarter than ever. And what do we want to portray to our patients that we're serving? What do we want to portray as business owners, dentists, to our team? So that's why we're having this conversation today. I'm going to start with Dr. Lambert. I'm going to ask you a question first, as obviously you lead an amazing team over in Grand Rapids, Michigan. You have a wonderful crew. And so you are in the trenches here, preparing your practice for reopen. You've had to have phone calls, obviously, with the ADA and getting your processes and systems and people in place. Where would you like to start with our conversation today?
Well, thanks, Corey. It's an honor to be here and to have over 400 people around the country listening. So thank you for taking time from your busy schedule. And thank you, Michelle, who it's an honor to be with you today chatting. And I listened to one of your webcasts last week, and you're phenomenal on ultrasonics and aerosols. You're an expert, and we need your expert advice today. Well, a few weeks ago, I was over in Germany with Oral-B and looking at the development of a new brush for Oral-B in the German center. And next door in the next country, everybody was having coronavirus, and I escaped that, came home healthy to this new world. So here we were a few weeks ago doing all on fours and zirconium crowns and ultrasonics and healthy mouths. Life was great, and now it's all gone poof, poof. And we're wondering, well, are we going to be able to make our loan payments? Are we going to make our house payments? Where are we getting the food for our table? Are we going to be able to keep our team in place? And what about our patients that are running around with broken teeth and we can't help them? So we've really been paralyzed, and that's a tough place to be. And I understand, and the sleepless nights that so many of our dentists and team members have been going through. This morning I was at a bank trying to get another PPP loan because Chase, the big bank, didn't get it done. So now I'm at a local bank trying to get that done. And at 3 o'clock, I'll be on an ADA conference call with the committee to reopen practices. So I'm in the middle of it with you. I'm a dentist that understands exactly what's going on. A couple things. I'm a positive guy. Bob Marley quote: "You don't know how strong you are until strong is your only option." For the past few weeks, we've had no options. No options. We've been sitting here and confused and worried and troubled. So during the coronavirus, we get paralyzed. And Bob Marley says, when your only option is to be strong, it's time to put on our big boy pants and our big girl pants and take action. And now we're getting enough information, enough meat, that it's time to take action and prepare for a soft reopening. Prepare for it and start putting in place not the perfect world, but a new world. We're going to push the reset button, and our practices are going to pivot. They're not going to go backwards. We all think they're going to go backwards, but they're going to pivot to a new place, a new normal, and it's going to be awesome. But it's going to take a lot of work digging down deep to create this new normal. So a couple weeks ago, my dad moved in because he's 90. He was an FBI agent, and he's living in a retirement home. So he's living here, and he's inspiring me. And he said the other day, he said, "Tom, great leaders have 3 things. Number 1, they articulate to their team members where we are today. Number 2, they articulate to their team members where we're going. And number 3, they articulate how the heck we're going to get there." Because that's what every team member wants to know: where we are, where we're going, and how we're going to get there. Now, we don't have all the answers, but we're going to inspire you to be thinking through this process and developing your new normal and articulating and involving your team in that process. So my encouragement is, don't panic. The governors are going to be opening our states, but that doesn't mean the day they open the state that we have to sit in our office with a full schedule. No, we have total control of when we reopen our practice. And that's all based on PPEs and schedules, et cetera. We'll talk about some of those things today. So you're the owner of your practice. You're the team member that's going to work with the team to come back at the appropriate time with the appropriate equipment and treating patients in a brand new world. One of the topics that I want to talk about right now is testing, because that's all over the media. It's everywhere. And if we test, we can do this. If we don't test, we can't do that. But I'd like to read to you the ADA's position on testing. So here are the facts. According to the ADA Executive Director, Dr. Kathy O'Loughlin, the testing market is becoming a bit of the wild, wild west for companies right now. And there's very little scientific evidence that these tests are reliable. The American Dental Association Science and Research Institute has found that very few tests have met a high standard of 2 things: specificity and sensitivity. which means a potential for high rates of false negatives and false positives. So until we get this straightened out, testing is not really a viable arena for us. Two things have to happen for testing to really take place. The test must be scientifically proven to give consistent and accurate results, and the test must be readily available and affordable for routine use in the dental setting. And when that happens, we can all jump on board. But the ADA's position is don't be buying tests from source A and source B and starting to introduce those to your patients. That's the ADA's position currently on that. Michelle, I'd like to throw it out to you and have you talk about some of the things that impact our patient care.
Thank you. I appreciate that. And I definitely struggle with the expert role because I feel like I'm a clinician that's been poking the infection control beast for a few years now, just like asking a lot of questions and like begging people to pay attention to some things. And aerosols are definitely one of those beasts. And I definitely am not excited that this happened to our world, but I'm excited for the movement that we will see, moving that needle forward in the infection control protocols that I think we've needed for a little while. And, I think you make really good points that we have to have transparency and discuss with our team, like, where are we going? How are we going to get there? And for me, what I think needs a big conversation to have before we get that soft launch underway is, where are we in our practices? Where are we in our infection control and infection prevention and exposure prevention protocols? If we take the time to dig into our, to the CDC guidelines and follow and make sure that we're hitting all those marks, because I think that that's going to help to be less overwhelmed in what's to come if there are changes, because no one knows. Like, we don't know. We know we're in this crisis mode. We know there's some guidelines for this interim protocol, but what's to happen in 6 months? I mean, it's all speculation. I mean, we can probably take some pretty educated guess and some guess for like what might happen. Like, I might always forever have a face shield. Like, that might be the new normal for me and might be mandated by OSHA just because they want to protect the worker. But I think if we just kind of all get on the same page as a team with our infection control standards, where we stand right now in our office, like if an OSHA inspector walked in today, what would we pass or would we not? Would we have to make some changes? And I would also like that the conversation to be, before we get back into it, like, what kind of training are we going to have on a lot of these new protocols? So if we do look at PPE, and I'll talk about PPE as far as like it not being the most effective protocol that we have out there, but if we look at PPE, I was actually in my office yesterday, because this is a conversation that we're even having. We're a volunteer outreach that I'm at every week. A lot of our dentists are over 65, left their practice. And so they're concerned. They are really concerned about coming back and like what's that going to look like for their health? And is it worth giving their time to possibly put them, so they're not business owners, but like, do I give to charity and possibly get myself sick? And so there's a lot of things that we're having to like deal with from the outreach public health standpoint. And one of the things that I was practicing yesterday, because I was going through all my equipment, because I'm really trying to make sure our high volume evacuation is top notch, because I think that that's going to be super important for us when we come back. So I was going and cleaning all the lines and all that stuff. And I had my PPE on and I put my scrub cap on, and I kind of like geared up just to see like, what's it going to feel like? And if I'm changing that gown, well, gosh, then I got like my light that's all looped through, and then I have my loops. Like, what's my flow going to look like? Because doning and doffing is going to be really critical with all this PPE. And now I'm like, oh my, I'm going to have to like practice. And I was pretty good at my PPE doning and doffing, but even I'm going to be like, okay, like I wasn't taking my gown off and now I am. I didn't have a face shield. Like, how's that going to feel? Like, you need to practice these things, because when you do show up in that soft launch and you see that first patient, it's going to be like, oh, wait, okay, did I touch it with dirty hands? Am I clean hands? What's my hand hygiene protocols? And then
that's a good point, Michelle, too. Just, I'm thinking as I'm listening to you speak, because I've been in so many practices where infection control was not a priority.
Yeah.
And now we've gone from zero infection control or care to now, oh my gosh, what are the guidelines? Do I need a
spotlight is on it, right?
mask? You know, do I wear a disposable gown? You know, do I do all these different things? And so it's been kind of interesting for me as a practice consultant to see my doctors that don't even wear a gown. Some of them don't even wear a mask. And now they're like, oh, I can't open until I have all these standards of care. So, you know, that's kind of my concern too, is to your point. I love that the thought of practicing that through and getting together as a team, being able to state, this is mandatory now. We are all wearing disposable gowns, or your laundry stays here. You can't go home with the clothing that you had on before. And it's not my understanding from what I've seen, and perhaps the two of you can let me know if you've seen something else. We have guidelines, but we don't have any mandates or requirements. Is that correct? Or am I missing something?
Well, the ADA's position is they're making recommendations, not mandates. And on the ADA website, the statement is, use your professional judgment related to treatment provided and the patient's risk. Professional judgment should be exercised when considering the use of gowns, foot covers, and head covers. So they're not mandating, they're suggesting, recommending, and that we as dentists use our professional judgment. And I hope everyone saw the chart on masks on N95s, and the KN95s from China are
We
now
posted on our Facebook too. I think we'll check that again.
I'm sorry?
Yeah, we've posted that on our Facebook page.
Well, if you can get a hold of them and they're approved, then that's an option. I did hear from my rep yesterday that there will be more N95s coming our way as the medical demand, that curve goes down, the floodgates will open up. So we're really dealing with two things, ideal and reality. And right now they're way apart, but over time, reality is going to get closer to ideal.
For sure.
And in the interim, our basic objective is to have a safe environment for our team to work in, safe environment for our patients to be invited into, and do the best that we can under the given circumstances, where we have to assume that every patient that comes in has COVID-19 because there is no accurate testing. It's just like when HIV.
We're supposedly practicing that way anyway as dental professionals. We're supposed to be practicing that everybody coming through our door has something.
Right.
Yeah.
And to Michelle's point earlier, we've gotten away from that. And now this wake-up call is here. Now what are we going to do moving forward? And the masks were a huge question with our attendees. When I looked through all of that, they all wanted to know, like, can you reuse an N95? What's the KN95? Can you take the N95 and wear a surgical mask over it? And, they had a lot of questions, which I think are great questions to have. But, part of the problem is we don't have these masks yet. Most of our clients don't have them. Some of the reps I've talked to say, got to be careful where you're getting them from, because you can get them from eBay or Amazon and they're not really approved or whatever. So, would we feel comfortable doing a soft launch without these N95s? Where do we go with that issue?
So one of the things that I would encourage everyone to keep bookmarked on their webs or in their browser is osap.org. That is it's an organization that's usually member-based, but it takes all the considerations of ADA, CDC, FDA, EPA, OSHA, everything into consideration, and then it comes out with recommendations as well, based on what can we do to create the safest dental visit for everyone. And they are updating that every single day. And there is a COVID-19 toolkit on their browser. And in there are the CDC.gov has, decontamination and reuse of filtering face piece respirators. It was last updated, it looks like April 13th. And so I would just continue to monitor that, because even if I said something right now, tomorrow could be a very different world for them. And, I think just looking at again, I'm looking at all of the websites. I'm looking at FDA, I'm looking at EPA, I'm looking at all of these things, because also we got to take in consideration our environmental infection control with our disinfectants and barrier wraps. And not to digress, but another thing that we have to remember is like PPE for us is literally the least protective barrier. There's so many other things that we need to be doing to create a safe dental visit for our team, for us, for our patients, and the people we go home to, because we're taking that with us in a lot of ways. And I think right now we might, like you made a great point, Dr. Lambert, like reality and what the future is, like we might see these things. So right now we might be like changing our clothes and shoe covers and hair things and face mask and, N95s covered with a surgical mask. Like that might be today or whenever that soft launch happens. But then that reality is going to be like, okay, now we have more data. We have more evidence-based research to show like this isn't as effective as we thought. It's not as big of a concern. So maybe we're not wearing shoe covers. Maybe we just leave our shoes at work, or, maybe we just have to launder our pants or if we wear knee-length gowns, it's not a big deal. So I think it's just going to be a very different world. And I think every week is probably going to look very different. And it's more of staying abreast to those new changes. That's going to be super important for us.
Yeah. So many of the caregivers in the hospitals are using one N95 per day, per week, per month. That's the reality. You hear the stories, and they're covering them with external masks that they can wash, and they're clinging to that one N95 that they have. So that's their reality. Mm-hmm. Our reality may not be quite that way, but we're preparing with the N95s that we do get, and I've begged, borrowed, and stealed to get just a few from some of the specialists that are so kind. Thank you, doctors, to maybe get 5 or 6, and then we're going to treat them like gold. My wife's making, she can sew, she's making outer masks for those, and we're going to launder those, and I'm going to have 20, and I can take one N95 and make it last until that reality moves more to the ideal when we have a supply coming in. Mm-hmm. So that's our current reality.
Do the two of you believe that there should not be a soft launch if people do not have their N95s or other PPEs in place as a team? Or should you, I guess I'm asking you guys because I'm getting doctors who are opening Monday. I have doctors who are not going to open until June. And some of them have, obviously consulted with us as to what we would like for their protocol. And some of them listen, some of them don't. Obviously, as a business owner, you're free to make your own choice. But the two of you, what do you recommend needs to absolutely be in place for a soft launch?
The ADA guidelines say that if you use a surgical mask, you have a moderate risk. If you use an N95 or a KN95, you have a low risk. So and then we use our judgment.
What about PPEs as far as face shields?
My top 3 things that are clear and distinct that I'm articulating to my team and will have in place is mask, face shield, gown being changed between every single patient. So we've been looking for disposable gowns, and they're few and far between. And the single-use gowns are $3 to $4 a piece. We have used a laundry service in the past, and they have gowns today, which we checked with Valley City Linen, that are under $1 rental and laundry per gown. So it's less expensive than the disposables. And that's the route that we chose to take this morning, to change gowns between patients and use a laundry service to accommodate that.
So what about communications between the team feeling unsafe to return? Dr. Lambert, maybe you can talk about this since you obviously had to have this practice or this communication with your team recently as you're preparing for your reopening. How do you communicate with the team as far as keeping them in the loop, helping them feel comfortable to return, or if they don't feel comfortable to return, what are some things we can do to kind of communicate that way?
Sure. So once a week, we do a Zoom meeting ever since the day we closed, that Monday morning at 6 o'clock. We've had Zoom meetings every Wednesday for an hour, and the entire team. And we first talk about how we're doing. Are you getting your unemployment? Showing that really no one cares how much I know until they know how much
you care.
I care. And that goes for each team member to team member. So our meetings on Zoom are mostly around how you doing at home, how's the dogs, how's the kids, are you going crazy with school, did you get your unemployment? And then we articulate where we're going. And I've had them I gave them opportunities to take CEs online during the interim, mostly on disinfection, sterilization, et cetera, to keep us in the loop. And now as we're preparing for a soft opening, and we don't know exactly when that is because our governor has not stated when we're going to open our state, but that doesn't matter to me because we're in the preparation phase. We're not going to wait to act and scramble the day she says, hey, here we go. We're preparing ahead of time to get all of our systems in place. And the day that the governor says we're ready to go doesn't mean that morning that we're going to walk into a full schedule. No way on green earth are we walking in on that Monday to a full schedule. Soft means squishy.
Yes.
Fluid.
All the
It might
systems we
change.
had in place with 10 hygiene visits a day, backed up, waiting room was full of people, they're lined up at the front desk. No way. New world order. New world order. We're gonna be allocating much more time to that. So now's a good time. Let me go through a vision that I'm planning in my team's mind. And again, this is our initial formulation of our first time I've ever baked a cookie. Okay? Or my wife baked a cookie. Well, her cookies are just exceptional today. They're called Janita Fay cookies. And she's experimented and added flavors and taken certain things out and put new things in. And now her cookies are world famous. So this is our first cookie. And our first cookie is not going to look the same 2 weeks out and 4 weeks out. But our first cookie is going to be communicating with our patients in a text message or email. And we do videos. I do videos 3-4 times a week and send those out to our patients on email and Facebook so that they're in the loop and they're informed. We're not just leaving this void out there from them wondering what's going to happen. And then they look at us as the expert and we're guiding their care. So at the beginning, they're going to come for their first visit and we're going to greet them in the parking lot. And they're going to roll down their window and we're going to take our infrared thermometer, check their temperature. Now, does that mean that they're disease-free? Heck no. We know that they can be 5 days with asymptomatic and not have a temperature. But it's one protocol that we can rule out. If somebody has a temperature, go home, come back another day, okay? Hand sanitizer, and we're gonna ask every patient to come with their own mask or their own face protection, just like they wear to the grocery store. Because guess what? We don't have enough PPE for us. We don't have enough PPE to allocate for our patients. So we're gonna ask them ahead of time to come with their own face protection when they leave the car and walk into our treatment room. And when they're done with their appointment, they're going to put their face protection on and walk straight back to their car. So that's our initial protocol. We can use hand sanitizer.
Are you going every other treatment room too, Dr. Lambert? I've seen some of that out there too, where people are saying don't put patients side by side in each bay. I mean, we're looking at, again, a protocol of a very soft schedule, 90-minute hygiene visits, 20 to 30 extra minutes on restorative visits, and then maybe bay 1 and bay 3 are open, and then 2 and 4 are filled with patients.
Yeah.
Are you doing that as well, I'm assuming?
I haven't considered that, but that could be an ingredient in the cookie, sure.
Mm-hmm.
Yeah.
That's why we're having this conversation.
Yeah.
On your soft opening, yeah. Yeah. So, and then again, of course, the reception room, we can't have people sitting around in the reception. It's closed. It's closed. And until further notice, until that our new reality moves forward, it's closed. They're going to be in their car. And if there's multiple family members, they stay in the car. And if the little kids are comfortable coming in without mom, in they come, mom stays in the car. If not, mom will come in and be in the treatment room with them if that's necessary. Yeah.
Mm-hmm.
How is your team responding to returning when you have these meetings? And
Yeah,
I know
well,
some of them joined us today on the call, which is great support. But I know with some of my offices, I have some of my clients that are really struggling with employees that feel safe coming back or want to know when they should come back, or do you have to follow what the governor of your state is saying, or when should you open or when should you not? And I'll talk about this a little bit towards the end of this meeting, a little bit what the CARES Act does protect from an employee standpoint. But, you know, this is a question that's coming up very, very regularly from owners and employees. What if somebody doesn't want to return, or somebody isn't going to, or if you maybe perhaps don't want to bring them back? How do we handle those types of concerns as we start this?
well, our new reality, when we push the reset button, two things are going to happen to teams. Some team members are not going to be comfortable coming back into the dental environment.
Yeah.
They may not feel it's safe. They may have children in the home that are at risk. They may have spouses that are at risk. They may have fathers and mothers that are at risk, and they may choose to say, you know, dentistry right now is not for me, and maybe it won't be for them again. That's the new norm. Some of our team members will switch to not working, and some will switch to other careers. That is going to happen. And others are going to step up to the plate and go, you know what? I'm all in. I need the money. I'm going to work 6 days a week. Hi, Leah. Shout out to you. Yeah. Because the reality is we have this pent up demand, particularly for hygiene, this massive pent up demand. So if we ring the bell and tell everybody in our practice on an email that we're open on May 3rd, what's going to happen? Chaos.
Yes.
Not organized chaos, simply chaos, with unable to answer the phones. So a soft opening involves not announcing that you're open to your patients.
Yes.
Not announcing it. You're going to invite specific people on your schedule and confirm them for certain times.
Yes.
On your soft opening that first week. And then as you look at your schedule and changing your recare, it's likely that we're going to need 10 to 15 minutes more per hygiene appointment. Doctors, I don't like it.
Yeah.
We had a system. We rocked it out. Okay. It worked. But the new normal with what's happening in the parking lot, to getting them in, to the sterilization, disinfection, and as Michelle said, to doffing and donning. Are those the words?
Mm-hmm.
Thank you. Okay, new words in our vocabulary. Doffing.
I know.
Yeah. But we're going to need 10 to 15 minutes extra. So if we've got patients scheduled every 45 minutes, we can't just throw that schedule in 3 weeks right in the book. We have to move it around and take people in and out and modify it. It's going to take a tremendous amount of putting our big pants on and all hands on deck at the front desk, and even potentially pulling in some assistants and hygienists to man the phones and get everybody scheduled once we see that dynamics. So my thoughts are, we have a soft opening the first week. We look at how long it really takes to get a routine schedule in place. From that point, when we've established that vision, then we can articulate it and firm up a schedule for the future in the recare and move people into those slots after we've determined that. We don't want to schedule a month out when we haven't figured out really what our new reality is.
I'm curious too, because this is something that I've been playing around with, talking to some friends and stuff about. So for me, what I foresee is that people lost their health benefits in some way. A lot of them are financially they're struggling. And so dentistry might not be top of mind, right? Like even when they do go back, maybe they would like that hygiene appointment, but they can't do it. And for me, I'm asking my friends that are in private practice, and I'm trying to incorporate this into my outreach program. But like, okay, so if you're a patient of record and you can't come in, can we do Zoom calls or Skype calls? And let's talk about home care. Let's talk about like what's going on with your mouth. Can I send you a care package with a disclosing tablet and a toothbrush and all these things, so that we can really, truly step into our role of preventionist and prevent some of the inflammatory burden of chronic inflammation that we see with some of these patients, especially when we always had those ones that were building up all the time. They were always struggling. If they were the princess and the pea, where it was just a little bit of plaque caused a big old problem. Like, can we coach them through via teledentistry and kind of get ahead and show them that we care about their preventing a problem, so that they don't come in and we are having to do scaling and root planings when they were just perio maintenance or something like that prior.
Michelle, that's a great idea. And Lori, shout out to Lori. Lori and I have been doing the Dr.
Nice.
Tom teleconferencing with our patients, and Lori goes through Oral-B, Sonicare brushing, mouth.
I love that. Great job, y'all.
Call us if you have inflammation, and we'll phone in chlorhexidine Perio RX for you. Please let us know if you need antibiotics and you have swelling. But going through right back to the basics of oral health care, and that can be done now, today, with Zoom calls. And we've been doing that since day one, oral health care. For our patients, giving them tips and things not to eat. Avoid almonds, avoid sticky foods. We don't want the crowns pulling off, because I can't come in and put them back on. If they do come off, use toothpaste, use denture adhesive. So educating them and knowing that we're connected through Zoom. So I encourage all the doctors on this call to get on Zoom and email those through constant contact to your patients. Yeah, great point.
And, you know, from a soft launch standpoint that you asked earlier, for me, I don't think soft launch and seeing patients going back to normal is based only on PPE. I think there's a lot, I think as a practice, there are a lot of these hierarchies of control that have been established that a lot of us weren't maybe practicing. And I think they were there before. They're 100% going to stay there. So for me, it's eliminating the problem. And I hope it doesn't last only for the length of this pandemic, soft launches, COVID, interim procedures. But if you are sick, you don't come to work. And I know this is hard, and I'm not a mom, so I don't know how this is going to land with everyone, but you don't bring your sick kids to work either. I know, and that's like weird, but you're getting everyone sick, and we're a healthcare facility. And so bringing cough, sniffles, things like that, that's just a bad idea. It's just a recipe for a problem. We don't invite our patients into the practice if they are sick. And we've heard that for years, like, oh, you got a herpetic lesion, it's fine. Or you have a cough, you're off of work, still come in for your appointment, it's no problem. They wear masks. And it makes me itch when I hear people talk about it. I'm like, oh my gosh, no, like this is not okay, because it creates so many other issues for the patients that follow them. So it's not just me, it's the patients that follow them. It's the people hanging out with them in the reception area. Granted, that's not going to be the case first, but eventually we are probably going back to a waiting area. And so our, elimination to me, when we train as infection control preventionists, and as an office, like it's usually back staff, right? It's usually the clinical people that are in that training, and we're looking at our equipment and PPE and all that stuff. But I honestly think a lot of infection prevention starts with your front office team, because they're asking the questions on the phone. They're calling the patient beforehand. Have you been sick? Anybody in your house sick? Anybody contagious? Asking, these are important questions. And if they sniffle, cough, whatever in the waiting room, there has always been a respiratory cough etiquette. There should be signs in your office. There should be mask, hand sanitizers, tissues, touchless receptacles so they can throw their things. Those have always been there. And I think we all just need to get very familiar with them, because if anything, they're just going to expand. And then you substitute. The substitution for me, especially right now, is, okay, so doc, you have a patient that comes in, they lost a class 2 MOD on a molar. Well, for me, I'm like, okay, let's do silver diamine fluoride. Let's not put a high speed to that right now. Let's not create aerosols. Like, what are some of the things that we can do to prevent aerosolization of a lot of things, and spatter, spray, and all that? And then you have engineering controls. And this is where I think a lot of training is going to go into it. So not only are we adding time to our appointment about PPE, doning and doffing, going out to the car and having these conversations, but engineering controls. And I adopted my high volume evacuation over a year ago. It is still to this day cumbersome for me doing it by myself. I've tried a gazillion of them to help me maintain the aerosols and the spatter, but it takes some time to train on those. And, even things like your utility gloves, you should be using that in, your instrument reprocessing and op reprocessing. But if you've only used exam gloves, they're going to feel like you are a NASA, like astronaut in space working with the giant gloves. Like it's going to be cumbersome and it's going to take some time to train through that. So you got to give yourself this, the before and after of these patients so you can adapt and train through it. Even if you integrate.
Let me just quick interrupt you.
Yeah.
A lot of our attendees had concerns about aerosols.
Yes.
Both hygienists and doctors wanted more clarification on aerosols and what procedures to possibly avoid right now or not. So what do you, as far as training on these things and using dry shield and isolite and all these other things, is it something where maybe our owners, our doctors should have the team come in and we physically train on this together? And
I don't hate that idea. And maybe you're not creating like a ton of aerosols, but you're just like, you're not creating the problem that you might, some of them have COVID in your place, but yeah, train through it. Like
more in triage, would you say maybe no air polishers, no ultrasonics? I mean, Dr.
In
Lambert,
the interim, I would be cautious. And until like in each state, you've reached peak, you're decreasing the number. Like I would be cautious for all those things, even high speed use. And that's going to be different for each state. New York, I don't know when they're going to be using high speed and aerosol producing procedures again. But me in South Carolina, like we are not terrible on the grand scheme of this. But yeah, definitely training through it. If you're going to have HEPA filters or air filtrations that you integrate into your office, know how to work them, know how to clean them. If some people are even talking about UV sanitizers, know how to work them, know your instructions for use. If you are doing something with the different types of high volume evacuation, not all of them are great. Like there's some that work for certain people, certain procedures, and certain clinicians, and you're going to have to define that depending on the person who's doing it. So me as a hygienist, I for a lot of times will use my isolite and a second high volume evacuation, but not a lot of my patients tolerate the isolite. So then I have to deviate and go do something else. I'll be very honest with you. I've been doing so much research on aerosols in the last actually 3 or 4 years. None of them are perfect. But what I think is exciting is that we are looking for it now. And so now people are doing research. Now they're doing more in vivo and in vitro, and then eventually more in vivo information about like what is actually going to work. And it's going to be different for everybody. But I think more importantly, it's to have standard operating procedures. If you are doing this type of procedure, these are the things that you have in place to decrease the spatter, splay, droplets, and aerosols. And you come up with that as a team. And if Corey, you like, Michelle, you struggle with sizing that isolite thing, like then I need to train up on it. And so we have that conversation. And I think as a team, we hold each other accountable.
How can we train when we can't have people come into our, I think about this traditionally, right?
My wife is coming in this week, and Lori is going to work and do some ultrasonics on her teeth. And we've ordered a variety of different suction systems, and we're going to experiment with those. We're introducing HEPA filtration into each treatment room and throughout the office. So we've ordered 5 or 6 of those and with extra filters to be changed. We're looking into ultraviolet sterilization disinfection. I've been on calls with a number of companies that have those. And even
what exactly is that for those of us that are in the audience that are not familiar with what the ultraviolet, what is that? Tell us what that is in our practical terms.
Well, there is a variety of light systems that break down the virus, the outcoding the virus, and it dies.
Really?
Some are safer than others, but it's a whole new area that we're all looking into. There's no clear picture, and the ADA's position right now is don't go out and invest in all these new systems until we get clarity.
More research.
Vision, something you see so clearly that you act upon it. Until you see clearly, don't act. But that doesn't mean that we can't, if we want to invest, try some things as dentists. We're entrepreneurs. We're outside the box thinkers. So we're implementing air purification. We're looking at UV light systems. We've already ordered the clear plastic sneeze shields for the front desk, just like you see in the banks and the grocery stores. Our patients are going to expect that, whether or not it's mandated. When they come into our office and they see it at the grocery store and at the bank, yeah, so Amazon has those. Get those ordered for your front desk.
The plexiglass in front of the administrative area, are we going back to that basically? I mean, I remember back, you know, what, 10 plus years ago, we had, you walk into your physician's office and they had the plexiglass and then rid of them to open everything up. And I mean, is that what we're doing? We're going to that in dentistry too, where?
It would be, and it's kind of hard because we've been in this, take care of our patients with paraffin hand treatments and warm eye masks.
Yeah.
And
yeah, we got away from a lot of the basics of infection control prevention.
And one of my doctors, Dr. Doring, hello Arthur and your wife, we had a conversation last night about this depersonalization for patients that are coming in. They're anxious, and we've pampered them and got them to this comfortable place, and now we're going to blow that all out and show up with masks and shields. And so Arthur, that was a great point. We have to keep that in mind, that we still have anxious patients when we're greeting them garbed up like we're going in for open heart surgery every time they get their teeth cleaned.
Well, dentistry is so relational. I mean, I noticed this among my clients, and I noticed it among just those of us that have treated patients or are still in patient care. You know, most people, most providers refer to their patients as their friends. You know, they refer to them as more than, oh, that's just a patient of mine. No, like we develop true bonds with people in dentistry. And so this is a whole wackadoodle normal to us that, you know, yes, I'm coming in and I'm your hygienist and I'm all garbed up, or I'm your doctor and I've got 3 assistants helping me today. And it's like, it is a very strange feeling.
It is.
It is.
Susan Wingrove out in Montana. Hello, Susan. Susan's an expert in maintenance of all-in-4 implants, implant maintenance, working on her 2nd book right now. Hi, Susan. Susan called me last night and she said, how about Gordon Christensen's clinical research publication? And the new one that just came out last week, it goes through and they articulate sterilization, fluids, liquids, et cetera, and dealing with our new reality. So I encourage everyone to look at that. If you don't sign up for Clinical Research Associates. That's a phenomenal research organization in Utah that gives us clarity on situations like we're dealing with today.
Yeah, thank you. Yeah, thank you for that. You guys have been a wealth of knowledge so far. I appreciate addressing and weaving in those questions that I gave you in advance from those that are listening right now. And due to the large number of people on this webinar, we could not open up the chat box or Q&A or anything like that. So, you know, I appreciate you guys doing the best you can to kind of facilitate, and I appreciate that so much. As there's so many different topics, because it obviously involves, people are concerned about their safety. We're concerned about, you know, unemployment and when we're coming back. I've gotten different people questioning me on their state's policies, and those are things I simply can't address. You know, if you want to, again, shoot me an email, I can certainly give you the right resources. But one thing that's really concerning is when you have employees that don't want to come back. And, you know, my advice to those of you that are dealing with that right now is your employees are protected under the CARES Act. However, you are a business owner who is allowed to process your business the way that you wish. And so you may have to hire in the interim, and that person may either not return to you, or you may have to hire temp people. So if you need facilitation through that, contact me personally. That's a whole nother topic. I know we had some questions in that regard, and we could talk about that just an hour alone on this call. So if you want to talk a little bit about that, let me know. But be aware too, due to the CARES Act, whether you got the money from any of the SBA loans or not, employees are protected. It does not matter. So many of my doctors always think, I'm 50 employees or below, nothing applies to me. That game is off, my friends. It is off. It does not matter how big your business is. This whole COVID-19 and the whole element of bringing on new employee rights is a whole new game. So you can't push your head in the sand and say, you know, I'm under 50 employees, it doesn't apply. Everything applies right now. So if you need specifics for your state, send me an email. I'll give you the resources that you need. But I do appreciate the conversation, and I do want to ask a couple more questions to both of you that I think is just been so great. What do you guys do with with patient communication? Like, what are we doing to let patients know they're coming back to this safe environment? Do we just kind of, I mean, I don't believe that we should just go business as usual, like, hey, we've always had a great dental practice. Because honestly, I'm in a ton of dental practices and they needed to clean up, you know, junk all over their countertops and this and that. Like,
Yep.
What are we doing to let patients know they're coming back to a safe place?
Well, we go right back to Zoom calls and then videos. Like I filmed one yesterday in my home and sent it off about testing because of the confusion. So then they have factual information quoting the ADA's actual quotes in their science and research, and now they're getting facts, and we become the source of great information. And then when they do come back, they're going to trust us with their care. So if they don't know we're a great dental team unless we tell them we're a great dental team. They don't know that we're excellent in implant services unless we tell them about the courses we've taken. So they don't know that we really are doing 10 extra things to help them have a clean environment unless we articulate each one of them and let them know that we're implementing A, B, C, D, and E, and we're getting ready so that when we come back, it's going to be a safe environment. Yeah.
Good.
I wrote an article actually at the beginning of the year that got published at the beginning of April at Dental Economics on marketing your infection control procedures.
Good.
And I have always felt like we needed to embrace our infection control and how we keep our team, our patients safe during every single visit, because quite frankly, we're seeing this if I don't go to when I go to the doctor, which is hopefully pretty rare, I'm hoping I don't go very often, but you know, there's signs of like, if your nurse didn't wash their hands, this is how you report that. If your doctor didn't wash their hands or didn't use a hand sanitizer, so people are very in the know these days about what should happen. I've even had my patients be like, you touched your hair, are you going to wash your hands again? I'm like, I didn't even realize I touched my hair. So thank you for that. They are in the know. And I think for me, I'm like, okay, if I've always responded to this patient, they are a big texter. Like they want their appointments via text. If they followed us on Facebook, if they preferred emails, or if they preferred a phone call or a letter, that would be how I would continue to communicate with them. And then incorporate, like, we have always done X, Y, and Z. You're going to see a little difference because of X, Y, and Z. And this might stay forever. It might be in the interim, but rest assured that we are following all evidence-based guidelines brought to us by our mothership associations and CDC and OSHA, and keeping you safe and our team safe is the utmost priority during your appointments. It doesn't matter if you do a beautiful crown and composite. None of that matters, I think, and if you make people sick. So it's all about, you know, just being transparent.
Michelle,
and I think we always should do that.
You're spot on. Because we have to get ready and be ahead of the curve.
Mm-hmm.
Because in a week or two, CNN and Fox News, that conversation is going to shift. And on that TV right back there, they're going to say, is it safe to return to your dental office and get your teeth cleaned?
Mm-hmm.
right there.
Mm-hmm.
That is going to be a topic of conversation on the daily and nightly news. And we have to be ahead of the curve, articulating. And the American Dental Association, Dr. Gahani and our team, I want to applaud them. They're working tirelessly 7 days a week. I have conference calls sometimes on Fridays, Saturdays, and Sundays. It's unbelievable, the effort and energy, and our membership dollars are well spent. And if you're not a member of the ADA, please join. They are lobbying Congress on our behalf, articulating to the public what we're doing. Our ADA, a round of applause for all of the volunteers that dedicate hours and hours and hours towards articulating that dentistry is safe and it's a wonderful profession. So get ready for the news, because they are going to articulate and question whether coming to the dental office is safe with aerosols right here.
Yeah.
Mm-hmm. Mm-hmm.
Well, thank you, Dr. Tom, for being a part of, the ADA and being a part of that committee too, to even bring us the news that you're bringing us today, and just, a few bottom line points that our owners can feel comfortable implementing into their practice. And Michelle, the same with you, just the aerosols and the element of infection control that so many of our team members and doctors are concerned about as well. I just want to do, as the way of ending, we have about 5 more minutes. I know both of you have other things to go forward to do too. I want to just do a little rapid fire of a couple of questions. Okay.
Ooh,
You guys feel ready for it?
All right.
All right. So these are questions from our attendees. Do I need an external suction? Yes or no?
Need is one of those questionable things right now for me. I would want one, and only because I've always wanted one, because my HVE is so cumbersome in my life. I think it would make my hand or my wrist health a lot better. And I think it would make my life a lot easier to just like throw something up against somebody's face and be like, okay, I got this, it's fine. But I do want to see more research for how well they work before I go investing in a ton of money. But I think Dr. Lambert made a good point. Like, so maybe you want to invest in something, try it out, see if it works, if it's loud or annoying, or if the patient's like, what is that thing in my face right now? There's a lot of questions.
So shout out to Deb Torres at Shine Dental. Deb's been with me for 25 years. She's just an amazing part of our team. And Deb and the Shine folks are looking at all kinds of extraoral evacuation systems. And I really feel that that's in our future. What I envision is that every operatory will have, coming from the ceiling, a tube with a cone of shame like the dog has.
Love it.
Around reverse.
Put it right there.
And
Yes.
It's a hood, it's right here, and you got the button on and off, and you pull it out of the way, just our light. So I truly feel that is going to be a new normal. And that once it's developed, we'll have central units up in the ceiling or in the basement, just like we have our suction systems, and it'll all go down and around, and that's going to be part of our new normal. And now that the demand is here, our new reality, the really smart engineers are going to design,
figure it out.
And that's so we have the ones in a box with the HEPA filters that make a lot of noise that you can have the tube. I've looked at those. There's certainly potential there, but I'm going to hold off on that particular item until we get a little more research on it. But I think it's definitely part of our going to be our new normal.
I must say, I'm really excited for trade shows after this, because I think all of those are going to be there, and you're going to be able to test and touch and all those things. I'm really happy to get back at that.
That brings me to my next rapid fire question. So how do we, and maybe we've already talked about it, but how do we prepare if there's another outbreak? That's one thing, which I think you guys have covered. And another question, do we wait to treat the 65 and older population and those that are in like memory and assisted care and so forth? Yes or no?
I think personally, there's a lot of things that you could do for that population that when they are open, people like Angie Stone that go in and do toothbrushing and management to prevent problems, I think is huge. I think also silver diamine fluoride might be really great for some of those populations in those areas, so that we aren't creating aerosols, and, always having the most effective infection control and prevention that we can, so we aren't cross-contaminating for that particular population.
Dr. Lambert, would you have your father have any elective dental procedures right now as a 90-something-year-old gentleman?
We're going to defer. Now, I did have a patient that we were delivering Deb 2 weeks ago, a night guard. She's a severe clencher, fractured some teeth. We just restored her the day before we closed our office with her new restorations. And she called me and said, you know, we took impressions for a night guard. Can I get it? Well, I gave it a second thought. Her husband drove to the office. I got in all my garb and I went out in the parking lot and I delivered her night guard in her car. In her car. So we have to get outside the box. I had to make a judgment call that if she went 6 months without her night guard, her teeth are going to come apart. So no, but she has lung issues. So would I invite her in the office for ultrasonic therapy? No way. We're not now. We're going to defer.
Yeah. All right. What do you guys think about taking payments for services? Should that all be done online? Are we doing that in treatment rooms? And then does that eliminate a potential position for someone in the office? How do we kind of deal with that particular issue?
Well, it doesn't eliminate a position.
I was going to say, I think it adds some of it.
Busier than busy, because it's going to be a bit more complicated to go through scheduling and collection, et cetera. So that's going to be a new normal. Maybe we do it over the phone. Maybe we do it in the treatment room. Maybe we walk in and take care of that there. So, you know, that's to be determined.
Y'all, my vet does this. I don't leave the room with my dog and pay outside. Like they come to me for all the things. The moment I walk in, I go straight into the room. So and they swipe it and all of that. And quite honestly, I think that this has really taught a lot of people how to live in this digital world. And all those people that you were like, oh, they'll never have a text message to confirm their appointment, or, you know, I got grandmas bringing their iPads and showing me pictures of grandkids on it. So never say never. I think if there is a change that you're going to have to guide and handhold some of these patients, but I mean, I think it's a great opportunity. I go back to like, how much time do you have between patients? And who's doing that? If it's me as a hygienist, it's now scheduling, turning a room over, taking payment, talking treatment plans, doing health history, doing oral cancer, sleep, all like we got to have the time for it. So that's,
I'm all about care. I'm all about care credit and financing. And I think that's going to be more important now than ever, with people coming back and been unemployed and having reduced resources. And it brings about another issue, which I'm hearing over and over again. How are we going to get reimbursed for PPE? And this same question came up back in the 80s when the HIV epidemic came and we had to introduce all these new PPEs. Insurance companies likely aren't going to pay for it. I don't think they're going to step up to the plate. So are we going to add in a fee? Can we? It's a point of conversation.
As a private practice owner, you can add in whatever fee you prefer.
Yeah, and we're considering in our office, and we're going to educate our patients about all the specific items that we're doing so that they're ready to make that investment and choose to come to one of the safest places that they believe they can go to.
Yeah. Well, hey, you guys, our time is up. I know you both have other things that you're scared to lean on to, but what would you like to leave our attendees with as we finish up our 1 hour
Go ahead, you go first, Michelle.
For me, I think that there's the opportunity to not be treating patients is so rare, right? Like we are always like, gotta go. How do we produce? We never have time to maintain our suctions and our dental water lines and reevaluate our standard operating procedures and our workflow and really reassess where our office is. And so I would hate for anyone to not take this opportunity and do all of those things, to come together as a team and be coached and trained and really take your practice to the next level. And for me, I totally believe that infection prevention is the foundation of every healthcare facility. We all took the oath not to do harm. And even if they get a cold, that's harm. And so we really want to do something, prevent all of these things and prevent us from getting sick and making our team members and bringing that stuff home to our family and our loved ones. So I would just say, take this opportunity, really reassess your practice, really dig into infection prevention and your standard operating procedures.
Thank you.
Well, I'll go right back to the basics, and our vision statement, our entire team knows is changing people's lives one person at a time. At this point in time, changing person's life one person at a time is involved in articulating a healthy place to come, a healthy place to return their mouth to health. Gum disease is rampant, and it's linked to cardiovascular disease, heart disease, cancer, all the things we've articulated.
Mm-hmm.
And we're going to continue to articulate that. And our primary mission is to have a safe environment, get our patients back in the saddle, get their mouth health back on even keel. And as time goes on, then we can go on to the exceptional things that we've always done and restoring them to beautiful smiles and all on fours, et cetera, et cetera. But articulate that, care for our patients, change people's lives one person at a time. And as my dad continues to remind me every night that this too shall pass.
Yes.
And to remember that our best is yet to come. Thank you.
Yes. Thank you. Thank you, guys. Thank you for everyone for taking time to probably have your lunch hour with us. We appreciate that. And we look forward to providing any other information we can. So please reach out to us at the office at customdentalsolutions.com. If you need some specific resources, I will be the one to get you in touch with those people. Dr. Lambert is incredibly busy, and so is Michelle Strange. These are very generous people. But contact us first, and if you need any more from them, I'll pass it on to them if you have something specific. But in the meantime, we look forward to your information, your contact questions. If we can be of service to you, we'd love to do that for you. But have a wonderful afternoon. For those of you that need a consult with some more specifics for your soft launch, please reach out to us at Custom Dental Solutions. We'll definitely do that for you. All right.